It's almost summertime. That means people will be getting outside and into the sun, but how much is too much? We're talking with a dermatologist on the Marshall Health Source podcast right now.
You are listening to the Health Source podcast, presented by the Marshall Health Network. Now here's your host, Rick Lord.
Welcome inside the Marshall Health Source podcast studios on the campus of Marshall University. I'm your host, Rick Lord, and today we will be talking with a dermatologist about skin cancer and dermatology and what you need to know before you get out into the sun with summertime here. We want to thank Dr. Shane Cook for joining us today. Appreciate your time, sir.
Thanks for having me.
Before we start getting into this, just talk a little bit about your background, what led you into dermatology, and what brought you to the Marshall Health Network.
Sure. I grew up in southern West Virginia. I grew up in just outside of a little town called Madison.
Go Skyhawks.
That's right. I went to West Virginia Wesleyan for undergrad and then to Marshall for medical school and did my training down in South Carolina at the Medical University of South Carolina. Growing up, I played bluegrass music with my grandpa.
That's awesome.
We played in various churches and other singings and things. And when I was about 15, he was diagnosed with melanoma and later passed. And that's really the reason why I'm a dermatologist today.
So that definitely left its mark, an indelible mark on your brain, really, to focus on doing that and trying to help others, I'm sure,
right.
in his memory.
That's correct.
And you get to stay close to home, so that's got to be nice, too.
It was very nice. The family really likes it.
Well, let's get into this because a lot of people will be outside this summer, and a lot of people will be getting tans, whether they like to or not. Sometimes just walking around, you can get tan. But is there any such thing as a safe tan?
I don't think there is a safe tan. I think that the sun is important. I don't think sun avoidance is the answer, but we have to be careful not to get sunburned.
And is that the threshold that you're really looking for when you start seeing that damage on your skin as a burn? Anything below that, usually okay. Anything above that, that's when you're really in danger.
Usually okay.
I don't want to speak in generalities, but I mean,
It sort of depends on your skin type, but for the most part, as long as you're not getting burned, the sun's probably okay.
Okay, and you talk about skin type. That's what a lot of people are wondering about that as well. Do you have, if your skin tone's different, do you have different risk? A lot of people think, okay, if I have a darker skin tone naturally, I might burn less.
That is correct. We have different sort of melanocytes. That those are the cells that sort of produce the pigment in our skin,
right.
and each of us have different, the volume of melanin we produce. Those that are completely pale are increased risk for getting more burns, more skin cancers, more of the skin cancers that are associated with the sun, but those that have darker skin can still get skin cancer. Bob Marley died of a melanoma on his foot.
Right.
So,
interesting. People when they're out and about can get tans. People also purposely try to get tans by going to tanning beds. What is your take on those?
Tanning beds are tough. I know that people sometimes think tan skin, it looks good, right?
Sure.
But it's just so risky. I see lots of patients who lay in a tanning bed as a teenager or earlier, and I've seen skin cancer in 20-year-olds, even that early. So there's nothing about a tanning bed that is good. If you need some heat, maybe get a sauna instead.
And you mentioned the rate. It does seem, and I don't know if this is just colloquial or anecdotal, but I have seen that it seems like younger people are being diagnosed with more cancers, including skin cancer. Are you seeing a rise in the rate of skin cancer among young people, or is it just that we're doing a better job of detecting it? Because context always matters in that situation.
I think it's a little bit of both. It's tough to say whether or not patients are getting it earlier or not. I think more of the time that these particular patients grew up or the time of baby oil and everything else, and so they had lots of sun. And once they get to 40 to 60 years old now, or maybe in 70, that's when the skin cancers start popping up.
Now, for a lot of people during the summer, you can't help but be out in the sun, out doing yard work, or what we would call just incidental sun exposure. Is that a risk as well, or is that something where as long as you're not outside like for a prolonged period of time, you should be okay?
Any sunburn, I think you can probably get sunburn within 30 minutes of being out.
Okay.
As a dermatologist, I actually hate putting on sunscreen. I tell my patients that. I don't like the way it feels. I still use it, but I really recommend a wide brim hat, the sun protective clothing. Okay. I kind of joke, but I really wear sort of a ninja suit, that have the mask in it, when I'm out fishing or just when I'm out, right? So I think that's a much easier way to stay protected while you still get a little bit of sun and feel a little better.
So that does work if you're just covered up, because I know a lot of times if people say, well, even if it's cloudy, even if you don't see the sunlight, you can still, those UV rays can still get through.
That's when most people get their sunburn. It's like, oh, it's a cloudy day out, the sun's not
Sure,
out, and then they
but
come
as long
back
as
and
you're covered up,
Correct.
specifically, you should be okay. And for those that do like to go the route of sunscreen, talk a little bit about SPF. We know that we've heard it, we've seen it on the sunscreen bottles. Specifically, what does that mean, and what do the numbers correlated to that mean?
Right. So the AAD, the American Academy of Dermatology, recommends an SPF of at least 30. And of that, it usually blocks about 97% of the harmful rays for a certain time period. You definitely have to reapply.
Mm-hmm.
Any SPF after that is, you're getting percentage points. The study I like to quote is a study where they took this group of people at the beach. They had them put 30 on one side, 100 on the other side. They scanned their face with a special device that showed sort of how much sun damage they would have. And at the end of the week, they analyzed them again. And the study with the 30 to 50 side had much more sun damage than the side with 100. So we still, even with the 30, you're still getting some sun exposure, some sun damage. So I would recommend an SPF of at least 100.
As high as you can
Right.
go.
Mm-hmm.
Okay, and just because it says waterproof on the label probably doesn't necessarily mean waterproof.
Right. If you're in the water, you should probably dry off and reapply when you get out.
Okay, and is there a difference between the spray sunscreen and the lotion sunscreen?
I think they probably work similarly. There's some data potentially out that suggests maybe if you inhale it, that's not good for your lungs.
Okay.
So if you are going to do that, make sure you're out from anyone else. You're not spraying them and the wind's blowing all in their face.
Okay.
I probably would recommend more of a lotion for the face than spraying your face. I see some people just close their eyes and
Yeah.
spray
Sure.
their face.
And when I use
Yeah.
the spray, I try to make sure that I actually kind of rub it in,
Right.
because it always seems like with the lotion that
Sure.
maybe it's just psychological, but you can see it going in the
Correct.
skin, and that
Right.
feels like you're doing a better
That's
job.
right.
So we talked about watching for that burn, and one thing that you said off air before we started talking is that just one burn substantially increases your risk in the future.
It
I mean,
does.
that's crazy to think about, that just one time
That's
you can
correct.
do that. So I mean, I would assume that there's a multiplier there involved, where it almost becomes exponential if you do 1, 2, 3.
It does. 3 to 5 burns, you're pretty much destined to get some sort of skin cancer if you're
Wow.
light skin, light complected.
Is social media making your job harder? You see all these influencers, and everyone's like, and especially, the influence that they have on younger kids and educating them. Does that make your job tougher to do what you do when people are having this drilled into them that, oh, you have to look like this or like that?
It makes it very difficult. And it's tough. Most of the people, if I could just speak to the audience.
Yes,
there,
please do.
Most of them are trying to sell you something, right?
Sure.
They've got this skincare regimen they're trying to sell you. And usually what they're selling you is not beneficial to your skin, or it doesn't really work. So I would just be very cautious on that. Find a board-certified dermatologist. We're happy to see you in our clinic, but certainly, find someone who is certified that can really give you quality information.
So let's dive into this. You talk about going to the experts, so to speak, which
Right.
you certainly qualify. For diagnosis and detection, what are some of the warning signs maybe that people ignore?
I like to separate them into the melanomas and the other types of skin cancer.
Okay, so you're talking like basal cell,
Correct.
squamous cell.
Correct.
Okay.
Yep. So for a basal cell or squamous cell, most of the time it's going to be an area that comes up that hurts, is growing, can grow fast or slow, but it's an area that doesn't really heal up. A lot of times the basal cells, it'll be just an area on the skin that is not healing. And patients will say, oh yeah, I got hit in the head with a stick. That's fine. If that area of the skin doesn't heal up within 4 weeks, there could be an underlying skin cancer there, and that's the reason why it's not healing up.
Okay.
So anything non-healing. If we jump over to the melanomas, those are the ABCDE criteria.
Okay.
And are you familiar with those?
I've heard of the acronym, but for those that might not be, to explain what those letters mean in terms of preventive care.
Sure. So if you're looking at a mole, the A is asymmetry. So if you fold it in half, if it doesn't line up, that would be asymmetric. B is border, anything with irregular or jagged border. C is color, anything with 2 or more colors. D is diameter, and we usually say bigger than a pencil eraser or so.
Okay.
And then E is the most important. E is evolving. If you have a changing mole, that one needs to be looked at.
Okay. And that's important because obviously people have all kinds of markings on their bodies, freckles, moles, and the vast majority of them are just part of who they are. And as we age, and I'm not trying to age myself, but you know, getting up there, you get those what they call liver spots. You
Right.
get different markings on your body, so it's important to know what are not a big deal and what are a big deal. And so that ABCDE can really help you.
It can.
And to simplify, just anything that looks really unusual or that is changing, evolving, the E.
Right.
And at what point do you recommend that they go to, as soon as you see it, is that something you call up your doctor, get a referral to a dermatologist?
I would. Melanoma or all the skin cancers, if caught early, they're treatable.
Oh.
But I've had patients who have a melanoma, we treat it, and then there's an increased risk of them developing another one. And typically we see those every 3 months. They come back, they have a new spot. We biopsy, it's another melanoma. So those can come up within 1 to 3 months, and those can spread pretty quickly. So as soon as you see one, you need to.
And that's the big thing, is that they do spread not only quickly but easily. And a lot of people, maybe that might be a misconception where they're like, oh, if it's bad enough, whatever, they'll just eventually cut it out and it'll be gone.
Right.
But that's not the worry. The worry is that it spreads to other parts of your body.
Correct.
Is there any specific place that it usually tends to go, or is it just depending on your own body?
It really depends on your own body. A lot of times melanoma will go to the brain. But sometimes it can go to the lung. It can go sort of to the skin around the site that you have the melanoma. So it's almost like someone, they call it a shotgun scatter, where you have multiple little pebbles around the area.
That's, and as you said, early detection.
It's key.
Talk a little bit about those rates and what that means, like in terms of if you see something, when you first detect that it's a melanoma and then you can tell that it's cancerous, in terms of like, okay, now I'm waiting 6 months. Do you have numbers that show what the difference is there?
We don't have great numbers on that if you wait, but we do know that if you're diagnosed with a superficial melanoma, it's called a melanoma in situ. That's in the superficial layer of the skin. If those are not treated within 30 days, if they're treated outside the 30-day window, those patients that are treated outside the 30-day window have a higher risk of dying of that melanoma.
Oh, wow.
So the 30-day point is key.
And is it something where you definitely need a referral? Did you go to your primary doctor first and then have them refer it to you, or?
So as a dermatologist, I don't require anyone to have a referral. They can call my office and get an appointment. Okay. There are some insurances that are changing.
Sure.
Where the insurance requires them to have their primary care doc to send the referral, but we don't require a referral at all.
How often do you recommend people perform like self-checks or just to make sure? And sometimes it's tough because if it's on your back, you might need someone to help you out. But I mean, how often do you recommend they do that?
A monthly self-skin exam, the first day of every month is the easiest way, because if not, you're probably going to forget.
Right.
So if you just look at yourself.
It.
Yeah, exactly. Schedule it the first day of every month. Anything new, changing, growing, we need to know about. How, if you have a significant other, have them look at your back. If not, there's a way you can sort of take pictures in the mirror.
Yeah.
There's a few apps on the phone. There's one from the University of Michigan called the Skin Check app, and it'll remind you every month, hey, it's time for your self-skin exam. And it even has photos. If you're worried about a spot, you can take a picture, and then you can show your dermatologist or whoever you see and say, hey, this spot is changing over the last.
And that's the important part is take it to your dermatologist. Don't let your phone be your doctor. We
Correct.
have a lot of people, especially in this age of AI and WebMD, which can take you down a rabbit hole that you're not going to end up being happy with. But yeah, so always go to the expert. Always get, they'll know what they're looking at.
Right.
Now, you talked about covering up and being outside, wearing the hat, loose-fitting clothing. And so a lot of people might think, okay, well, as long as I'm covered, I'm good. But is it possible, or is it not? I don't really know the answer to this, to get skin cancer in a place that maybe isn't normally exposed, like under your hairline or anything, something like that?
It is. Some melanoma is sort of genetic. So if you have any family history of melanoma, you should get checked out. And you could be the first person in your family to have those genetics to get it. So we see a lot of melanomas that are in the groin area. Even if you haven't used a tanning bed or had any other tanning practices where you've had a tan there, you get melanomas that pop up there. So it's still important to get checked.
And that's what's tough about what you do and about the medical industry as a whole is there's so much genetics tied into all of this.
Right.
It's kind of like a balancing act between lifestyle and genetics, and even maybe like diet. Is there anything other than just like staying out of the sun? Are there any other lifestyle changes that people can make to help them out if they're at high risk?
That's a good question, and there's a lot of information we don't know yet.
Right.
We do know that if you eat certain foods or take certain medications that increase your risk for like we call them photosensitive medications. So there's a blood pressure medicine, HCTZ, that a lot of people are on to control their blood pressure. It makes you way more sensitive to the sun. Those patients get more burns and actually have an increased risk of basal cell and squamous cell skin cancer.
Okay. So some of those medications have interactions with each other. So that's
They
something
do.
that's why when you go to the doctor, they always say, what kind of medications are you on? Right? They're not just curious. They really need to know that kind of stuff.
That's right. That's
Okay.
right.
So that's interesting. All right. So now, are there any new technologies, you hear every year new stuff coming out that maybe can help or help detect early or help treat? Are there any new technologies that you're excited about when it comes to dermatology?
Yeah, it's not necessarily brand new, but there's a thing called mole mapping, where we have a patient who's had multiple melanomas, they have 50 to 100 moles or more on their body. Mm-hmm. They get into a studio, they have all their moles mapped. The AI can detect any changes within those.
Oh, wow.
The AI can't biopsy or anything, but it says, hey, this one has changed this much, and then that would, so the dermatologist, whoever seeing the patient, they would go and biopsy that. Okay. And not a lot of places offer that. Unfortunately, we don't offer it yet, but there's a few places in the bigger cities that would offer the mole mapping.
Okay, so it seems like it's almost like the next level of just taking pictures yourself and
it is.
comparing them every,
right.
Like you said, if you're doing it every first of the month,
right,
then
exactly.
you have that picture, you'd be like, okay, is that different? That looks different.
Right.
That's very interesting. A lot of people ask about immunotherapy, I'm sure. Mm-hmm. Is that something that you're seeing that has been helpful?
Immunotherapy has really changed the prognosis of melanoma. We would like to catch it early, but if we don't catch it early and it has spread, there are medications. There's a medication called pembrolizumab or Keytruda, and it has really changed the prognosis to where patients who would normally have a diagnosis of melanoma would be a death sentence. Wow. Patients are living for long periods of time and even having a normal lifespan.
That's amazing.
It is.
All right, I know you're a busy guy, so we'll get you out of here on this. Just for anyone that's listening or watching, what is your realistic daily skincare advice to simplify it? Because people sometimes they don't want to go through 12 steps, or like you said, sometimes you don't want to put on that sunscreen. But what's the easy thing that someone can do daily for their skin to make sure that they stay out of trouble?
I love that question because we get a lot of patients that come in that have 12 steps, and when I walk into Ulta, I'm just overwhelmed. Like, oh my gosh, like how could you ever, I don't understand. There's so many options.
Shout out Ulta, full disclosure. They're not a sponsor either.
No. So the things that are proven, you need a moisturizer or sunscreen in the morning. Okay. And you need to reapply the sunscreen if you are going to be out. The moisturizer itself protects. The sunscreen is going to help your skin look better. A lot of people have wrinkles and sunspots because they're out in the sun. So sunscreen as moisturizer is key. There's a medication called tretinoin that is sort of an anti-aging cream, but also helps to kind of remodel the skin. Put a pea-sized amount on your finger at night, 5 spots, rub it all in. That is all you need. Sunscreen as moisturizer and tretinoin. Now, if you want to go the extra step, you can get a vitamin C serum, and the data is best for vitamin C serum, tretinoin, sunscreen, and moisturizer. But really, if you just do the sunscreen and moisturizer, you're going to be ahead of the game.
There you go. And then use common sense, right?
Correct.
Don't go out too long in the sun and cover
right.
up when you can.
Right.
Dr. Shane Cook, thank you for your time, sir. We appreciate your help today. And be sure to like and subscribe to the Marshall Health Source podcast so you'll know when new episodes are dropping. We can't do this without your support. We can't do that without doctors like you. So we appreciate you. Take care. And until next time, I'm Rick Lord. Have a good one.
That was the Health Source podcast, presented by the Marshall Health Network.